Thank you for joining us for yet another episode of Budget in Focus, a conversation where we discuss Budget 2026, which is under the theme Putting People First. Joining me in studio to have a conversation on everything Budget 2026 is none other than the Minister of Health, Dr. Frank Anthony. Minister, thank you so much for joining us.
Well, thank you very much for having me.
Yeah. So, when you look at Budget 2026, generally, um, you had the opportunity to be in the Parliament when it was delivered. What are your thoughts?
I think it was an excellent budget. It was one where everybody can see themselves in the budget and benefit from the budget. You know, the budget was aptly titled Putting People First. And if you go through in the different sectors, you can see how the government has crafted a budget to really put people first. So whether it's in education, a child can go to school, they will be able to get certain benefits. So for example, the Because We Care grant went up to 60,000, you're getting a transportation grant, you're getting a uniform allowance grant. So that by itself is going to help parents, throughout the year. In addition to that, think about a mother giving birth to a child. Every year we have maybe between 14 to 15,000 children being born. And as soon as that child is born, you get $100,000. If you're 18 years and older, you get $100,000. This is something where everybody benefits. And I think when you listen to some of the measures, these measures can help people to acquire their own home. If you want to get a vehicle, it's more affordable now because of the reduction in taxes. If you haven't been earning a lot of money, you have the income tax threshold now has increased, so you now pay less taxes. So lots of measures, and I think they're all beneficial for people.
Yeah. When you look at, if we were to zone in on the Ministry of Health and the work that the Ministry of Health has been doing this year, there's an allocation of $161 plus billion. What will change for the average Guyanese patient visiting a public healthcare facility going forward in 2026?
So there are lots of good things that has happened, and for you to understand the transformation in health, you have to look back where we were, let's say in 2019, to where we are now. And if you do that comparison, you would see that there's been a drastic transformation. Among the ways that we have transformed the health sector is to put in new hospitals. So in the last year or so, we opened 6 new hospitals. One at Lima, one at Dekendron, one at Diamond, one at Enmore, another one at Bath, and number 75. And we thought that it's important because we want to decentralize these services so that people can have access to different types of services closer to home. So the services that we were able to provide would include a 24-hour accident and emergency, a 24-hour pharmacy, 24-hour laboratory services, 24-hour imaging, and in addition to that, we have a set of specialities that are at these hospitals: internal medicine, surgery, obstetrics and gynecology, pediatrics. So all these facilities are staffed with specialists that can deliver this type of care. And of course, I think when people go, and if you're inpatient, you're using the inpatient facilities, you would see that it's vastly different from what it was before, because we now have nice wards. Well, they're not even wards. I wouldn't call them wards. I would call them nice rooms. And in each room, you have 5 beds. And in the past, or in the older hospitals, when you're on the ward, you have to walk some distance to get to the bathroom or the toilet. In each of these rooms now, you have your own toilet and bath, and you have a lot of privacy. The rooms are AC, so there are lots of comfort in the facility. So it's almost, it's a different level of care. And you have next to the bed, for example, if you need to get a nurse, you can press one of the buttons next to the bed and you'll be able to get attention. And we have lots of electronics built into the system, so when that door opens and the nurse come in, we can actually measure how much time they're spending with the patient. So if you just come in and go out back, we'll know that. So there are lots of good things that are happening at these hospitals. But while we have built these 6 hospitals and opened them, we are also working on some others. So we have the pediatric and maternal hospital that we will open. We have the New Amsterdam hospital that we've been working on. We have a new hospital at West Demerara. We have a new hospital that we're building at Maruka, another one at Cato, another one at Letem, and very soon we'll also be doing a new hospital at Bartica. So this would improve the hospital stock that we have. And again, the people living in these communities would be able to experience health at a totally different level. So whatever we are giving to our patients on the coastland, people in the interior of Guyana would be able to experience the same quality of service in any one of those hospitals once we complete them. So I think there would be lots in store for people as we roll out this new infrastructure and put the personnel in place to provide service. So that's one side of things. We have also spent a lot of time to improve our primary health care. So we have maybe about 350 primary health care facilities across this country. And for those that are in the interior, we have been improving the service by adding telemedicine. So currently we have about 130 telemedicine sites. So what that means is if somebody is in the village at one of these health posts, and the healthcare worker there is having difficulty understanding or diagnosing that problem, they can get on the telemedicine platform, talk to a doctor, whether at the regional hospital or at the Georgetown Public Hospital. That person would be able to guide them because they're seeing that person in real time. And we can do an ultrasound, we can do an ECG, and we can interpret that to make sure that, what's going on with that person, make a diagnosis, and then we'll be able to treat that person appropriately. So this is a system that we have put in place, and it has been working excellently so far. And because of this system, we have seen a decline in the need to medevac people. And we have also been saving a lot of lives because there are instances where people might be acutely ill and they needed to be medevac, but if you didn't have an expert eye with that person, reviewing, then that person might not get the urgent attention that they need. So we have been saving a lot of lives using the platform, and that platform in this year's budget is going to expand by another 50 sites. So that's strengthening our primary healthcare services. Of course, we have also been looking at the level of service that we want to give, and we are doing more work in chronic non-communicable diseases, so heart diseases. We want to roll out to about 400 of our facilities. Right now, we would be probably about 250, where we are giving better medication for hypertension, better medication for heart diseases. So we want this to touch all of the health facilities that we have, and that they follow a protocol that has been developed by PAHO. We also, one of the big challenges that we have in this country is with diabetes. So diabetic patients, we want to manage them better, and we're putting the guidelines and we've been putting things in place to make sure that we can manage them better. So there are lots of positive things, because our intention really is that we can see you at a primary healthcare unit, manage you there, and the idea is to delay the onset of some of these chronic diseases, and if you do have the disease, to manage it so that you don't develop complications. So what all of that is going to add to is that you get longer, you live longer, and you live basically free of some of the illnesses for a longer period. And that's our goal. So it's not just about extending life expectancy, but also extending your health span, meaning that you'll be healthier for longer. And that's the goal that we're working towards.
Just for clarity, when you say primary health care facilities, you mean the health posts, the health centers,
Yes.
things of that nature, right?
And then in some of the district hospitals, we can also
Okay.
do some level of primary care there as well.
I want to touch on a really important and I think a project that will be extremely impactful in the future, the electronic health record
Mhm.
system, just launched a few weeks ago.
Yeah.
Talk a little bit about how that program is expected to be expanded in 2026.
So, generally we are accustomed to going to a health center. A lot of people go there very early. So let's say the health center opens at 8 o'clock in the morning. People are there from 6 and they wait because they want to be first in to see the doctor. And that really takes up a lot of time. So we decided we want to introduce an appointment system. So right now at Festival City, instead of showing up early, you can actually go online or go on your phone and you make an appointment. So you request that you want to come in and they'll give you a time when you can come in. And you go there maybe 10 minutes before and they'll be able to see you. So it's more productive for people. So that system, we are going to roll that out now at the Georgetown Hospital. So before the first half of this year, that system would also be in place at the Georgetown Hospital. So you don't have to come there and wait too long. So that's one part. The second thing, though, is that we want every patient that comes to any one of our facility eventually to have a digital health record. So we have started at Festival City and we are going to continue that process at the Georgetown Public Hospital. So by half of this year, we should have all the patients who are attending Georgetown Hospital to have an electronic health record. What does that mean for the patient? A lot of people who come to our clinics would know that when you come, although you're early, you sometimes have to wait for somebody to go and look for your chart. That sometimes can take an hour because they're not finding the chart, maybe longer, right? Now, with the digital health record, all of that is going to be removed because they just go type in your name, they'll be able to find the record on the computer. And so it makes it quite seamless. Now, when you're seen by the doctor, they're able to write their notes digitally. So that goes into your record. If you have to get some blood tests, for example, they can take the blood sample right there. It goes to the lab. You don't have to go to the lab and sit and wait for those results. Or you don't have to come back another day to go to the laboratory to get those results. Once the results are ready, it comes automatically into your record. And you can go on your phone or your device, whatever device you're using, and you'll be able to see your laboratory results. When the next time when you visit your doctor, they can pull up all the results on the computer because it would be there. If you need to do an x-ray, and all of our x-ray now, they're all digital. So you go there, you do the x-ray, and it goes into your record. If you do a CT scan, similarly, MRI, similar, it goes into your record. So you would be able to pull it up, get somebody to look at it. The analysis of the x-ray would be there. So these things, I think, are going to change how we practice medicine in the country. And also, when you see the doctor, they prescribe medicines. You don't have to get a prescription from the doctor. You will go to the dispensary and they would have what was prescribed for you at the dispensary. And so it goes automatically to them. They make get up your meds and they're able to give it to you. And so the next time when you visit, all of that is there. A lot of patients have difficulty remembering the names of their medication, but all of this now would be in your patient record. So there's a lot of value to this, and we strongly believe that this is going to improve efficiency, productivity, both for our patients and the medical people who are attending to them. And that's the system that we want to ensure that we roll out this year.
Dr. Anthony, a concern that permeated the public domain for at least one point of time, especially when the regional hospitals were being constructed. The question was asked whether or not we have the capacity to fill these hospitals with qualified and trained people. Government has worked extensively in 2025 to do that. What are the plans in 2026 to continue training and, if necessary, import that type of skill set here in Guyana?
So what we have done is to expand the training division in the Ministry of Health. So we have a whole division that looks at all the different aspects of training. So we have expanded that. We have more than 20 training programs that we offer in the ministry. So it includes nursing assistants, nurses. We are now moving into an area of specialization in nursing, midwifery. And one of the things that we introduced about 3 years ago would have been, how do we make a hybrid nursing program? So we were one of the first countries to pilot this. We got a grant through WHO, and they have facilitated a WHO center out of Brazil, the University of São Paulo, to come. Their professors have been working with our tutors here to make a hybrid nursing program. And not only did we make the program, but we have been teaching using this program. And this year, we'll have the first batch, because training a nurse takes at least 3 years. So while we have gone through year 1, year 2, we have a batch now that will be ready because they're now in year 3. And so this year we expect to graduate close to 800 registered nurses. And that's because of the work that we did before. And every year, from the very first time we started this program, every year we've been recruiting close to 1,000 people into our training programs. So as we graduate this first batch, couple months after, maybe 6 months after, we'll have a second batch. Couple months after, we'll have another batch.
Right.
And that would be a continuous thing going forward. So we have actually been able to satisfy a lot of our nursing needs by expanding the level of training. And we think that's the approach that we should have. And nurses also get better salaries now. Before the salaries were very low. And I think that has allowed for a lot of people wanting to stay and work in these different fields here in Guyana. Apart from nurses, we have also been looking at medical doctors. And the University of Guyana has now expanded its training program. So previously, they would take in maximum maybe about 60 persons for training. That has now increased to 120 persons. And that is because the government has invested in building new facilities at the University of Guyana, a new medical faculty, so they have capacity to train more. And this year, what you'll also be seeing is that the sites where we have the regional hospital, we will also be decentralizing training for doctors. So some of the clinical science, you'll be able to be in Essequibo in Region 2 and be able to get training there, or be in Berbice and get training and so forth. Because, and this was one of the commitments made by the President, that he wants to see these programs decentralized. So we've been working on that, and you'll see that being rolled out substantially during this year. So we'll get more doctors. In addition to that, we have also been working with partner institutions such as McMaster's. So we have a program with McMaster's where we are sending doctors who have completed their postgrad here in Guyana, They go on to McMaster's to do specialized training. We can send nurses there as well. So a lot of them are now going to do highly specialized areas, so vascular surgery, for example, cardiac surgery, and so forth. So we've established a number of partnerships, Canada being one. We have partnerships with Mount Sinai, as you know. We have partnerships with Northwell. We have partnerships with the UK, the NHS. And we are exploring some additional partnerships with King's College and some others in the UK. We have strong partnerships with India. Right now, we have two students that are at Polo. One of them, they're being trained to use HLA testing, which is important for a transplant program. Mm-hmm. We have another student that is doing cardiac surgery in India. This year, you will also see us establish some other arrangements with European countries, including France and Spain, and these would expand more training opportunities for doctors and other skilled people that we have or we need to upskill. Mm-hmm. So lots of opportunities. And we also have a good partnership with Brazil where we can send people over to Brazil for training as well.
Yeah, expansive stuff. Minister, I know we could spend an hour and a half probably just detailing what's happening in the health sector, but I want us to focus as we bring our program to a close. I want us to focus on mental health and non-communicable diseases. You know, as we all do, that these two areas affect a lot of people, a lot of families, mm-hmm. and even a lot of young people. What are some specific initiatives in Budget 2026 that will help with prevention and early intervention and things of that nature?
So, among the chronic non-communicable diseases, diabetes is a big problem, hypertension, cardiovascular diseases. Mm-hmm. So what we have done, let's take hypertension. We have developed new guidelines. We're training our physician to follow these guidelines, and we are buying the right meds to suit the guidelines. Okay. We'll be having stronger monitoring of our patients, and we will be introducing this year random audits. So basically, we'll have a team of people that would go into any facility, pull the charts, and see whether we are treating according to our guidelines. Okay. And that, we think, would help us to improve compliance with what is the standard of care, in this point of time. So we want to improve that. And the reason why we want to look at hypertension is that we see a lot of people, if they don't control their high blood pressure, they end up with strokes. And so we've seen a lot of people like that. Now, on the other hand, we're in this budget, we have put the resources to develop a stroke center, to put it in layman parlance, right? A neurological center. Mm-hmm. So if somebody get a stroke, we want to make sure that we can reach them early, and we can work with them and hopefully reverse the consequences of the stroke. And if they need to go through rehab, that we have all the right facilities to make sure that they can go through that rehab process. So that's a center that we'll start building this year, and it would help those patients. In terms of diabetes, we want to also start focusing our attention in getting people to understand what is pre-diabetes. That's before you actually get the disease, right? And if we start detecting people who are pre-diabetic and they take the right precautions, then they can delay the onset of diabetes. And even if you get diabetes, we want to manage you properly so that you don't develop the complications. Some of the complications for these patients would include a loose feeling on their feet. Some of them can go blind. They have problems with their kidneys. Some of them would end up with on dialysis. Mm-hmm. Others might end up with an amputation. So we want to avoid these complications. And once we control your sugar, there's no reason why you should progress to these complications. So there are lots of things that we've been working on, and we see that they're having an impact. The way that we've structured the program and have been rolling it out, and you'll see a lot more of that this year.
And on mental health,
And mental health, yes, we have been working in lots of different areas of mental health. For the first time, this country now, we for a long time, we had only 2 psychiatrists in the country. And we have changed that. Now we have close to 14 psychiatrists. And that is because we have developed a psychiatry program where we can train our own doctors in the field of psychiatry. Now, having said that, we also recognize that there are areas that we have to focus on, including substance abuse. And this year we want to have renewed attention on that, because I think some of the findings that we're seeing from like the school screening program and so that we're doing, we're seeing that there is a problem with substance abuse. And therefore, we want to have a very comprehensive program on how to address this, including if we need to have people in rehab to manage them, then that's what we need to do. So you'll see us start rolling out programs in that direction, because we feel that that's an area that wasn't served as it should have been. And we want to make sure that we can, those persons who are affected, they can get adequate care.
Yeah. Minister, as we wrap up our conversation, what would you say to Guyanese now looking at budget 2026, still trying to wonder where they fit in, where is or what is in it for them? What would be your message to those Guyanese?
I think for most people, you have to go and read the budget itself, or maybe listen to people who would give you genuine information. Because there are lots of naysayers. Some of them probably haven't even read the budget. They don't even know what's in there. And what they try to do is to distract. But I want to give you a little story. This week, I had the good fortune of meeting somebody from one of the other Caribbean countries. And I was explaining to them some of the measures that we have in this budget. And they said to me, we don't have this in our country. The things that you're getting, or a child living in Guyana can get for education. Older people in that country don't get the kinds of benefits that we are giving to our elderly. The population itself don't get any grant, right? So you don't get 100,000 because you're a Guyanese. Whichever, I don't want to call the countries
I know that's a nationality.
right? So you don't get it because you're living in that country. And it dawned on me how many things we're giving to our population, and people just take it for granted. But sometimes it's good to compare what others are not getting versus what we are getting. And in that particular country, right, healthcare is not free. They have to pay for it. In this country, healthcare is free. And if you need, from the most basic things, you can come to any one of the facilities, you get it for free. And to the most complicated things, because if you come to the Georgetown Hospital, you need to get a hip replacement, we'll do it free of cost for you. If you need to get a knee replacement, we'll do it free of cost for you. If you need to get an angiogram, we'll do it free of cost for you. You need to get stents, we do that free of cost for you. I don't know that there any country in the Caribbean that is giving this type of service to its population. So when people think that there isn't anything for you, just go beyond the surface talk, and you will see that there's lots of benefits for everybody. And it's not only in health, it's in every sector. There's something for everyone in this budget. That's why I said that, this is a great budget, and don't bother with the naysayers. There are people who would always be critical, And many of the criticisms that I've heard it for the last budget, I heard it for the budget before, but the same people that would criticize some of the benefits in the budget are the first ones to go and get those benefits. So don't be dissuaded by them. This is for all Guyanese. Make sure that you get your benefits, because as we grow as a country and as we prosper, as the economy does well, then we all should enjoy the fruits of that labor. And that's what this government is doing, making sure that everybody can benefit from the developments that are happening.
Mr. Anthony, I want to thank you so much for spending the last few minutes with us here and having this conversation. Thank you so much.
Thank you.
You've heard there from Minister of Health, Dr. Frank Anthony. Stay with us here on NCN as we continue to bring you more updates in relation to Budget 2026. Thank you.